Hey, good evening, everybody, or good morning, depending on where you are. We are back with another episode of the Credible Messenger podcast. I'm your host, Jonathan McMillan, and as always, I have brought to the table another person who I greatly respect and that I have worked with for quite a while now. She's a person who when I first met her, I wasn't sure exactly how have in common because she's just incredibly respected and she has all types of accreditations and what I lovingly say letters behind her name. She's at the University of Colorado in Boulder with the Center for the Study and Prevention of Violence. And I bring to you my friend, my colleague, Dr. Beverly Kingston. Beverly, welcome to the show.
Oh, thank you so much, Jonathan. I'm so happy to be here with you.
Oh, thank you for accepting my invitation to come onto the show. Like I mentioned, as I build out this podcast, my goal is to spotlight people who I know are doing great work from all aspects of gun violence prevention and youth violence prevention, so that people know that it's complex and that there's a comprehensive effort that's necessary in order to find solutions. And working with you for the last 6-7 years, I think that the way that you have supported the work happening in communities really defines what it means to have a comprehensive collaborative approach between academia and those who are in the community at the grassroots levels. I would love for you to have the opportunity to share who you are, the work you do, and how did you get involved in the work? How did you become involved in violence prevention and eventually leading the work at the Center for the Study and Prevention of Violence?
Thank you for that question. That's kind of a long story, but I will do my best to answer that. For me, when I look back, I had some experiences in childhood that were pretty rough for me, and some experiences being bullied in middle school, some violence in my family, and I guess I would say I had this sense that society doesn't have to be the way it is, that things could be better, that the systems could be better. So in my undergrad, I was at Michigan State University. I studied political theory. My major was actually called Justice, Morality, and Constitutional Democracy. And really, what that degree was about was taking a look at, what are the values of our society? What did other societies look like? And again, could it be different? And I finished that undergrad, and a lot of people went to law school with a degree like that, but I didn't want to go to law school, and I really didn't know exactly what I wanted to do. And it was a struggle because I was a mom, a new mom at age 21. Same semester I graduated, I had my daughter, and with a degree in political theory, it was like, what am I going to do with this? And so I struggled for a while trying to figure that out. But I ended up moving to Houston. I ended up hired to be the regional coordinator of the Houston office of Texans War on Drugs. And in that job, I learned about this concept of community mobilization and communities getting organized to, be powerful and to state what they need and to understand the risk and protective factors that were affecting them. And I only had about 4 months in that job before they lost all their funding, all of it cut off. And this was like my dream job. And so I said, I'm going to keep doing this work. That's what I actually said. Like, I love this work. I'm going to keep doing this work. And I ended up asking if I could take the computer, the desk, printer, everything, file cabinets, contacts. I took everything home. They didn't need it anymore. The whole state office shut down. Everything shut down. So I took it home and I just started making connections. And there was a community called the Gulfton community in Southwest Houston. And at that same time, they were getting millions of dollars. That and several other communities around the state were getting millions of dollars. This is 1995 $1.5 for youth violence because it was so high. So this Galton community, they were getting all this money. And I went to the meeting just thinking I was just there to support, or actually I was doing this work around True Colors, which is a personality assessment that can really, it's really a great tool that can help build communities. But when I heard what this funding was doing, that they wanted to form coalitions, they wanted to address the root causes of violence, they wanted to use a comprehensive approach that was prevention, intervention, treatment, aftercare, I was like, oh my God, I love this. And I started volunteering for that. I didn't have a job. So I just started helping out, and I ended up becoming the director of that initiative. And I worked on that for, about 4 years. And we were doing all kinds of such cool work. We started a summer camp. We called it Campo do Sol, and we served hundreds of kids in the community that had nothing to do over the summer. We started all kinds of programs. We had a coalition that met monthly. We formed partnerships between the community, which was a smaller community within Houston, with the U.S. Attorney's Office, juvenile justice, human services. All the partners were coming together at the table, and it seemed like things were going really well. But I had this question. We were serving tons of people. People seemed happy. Is what we were doing working? Were we doing the best things we could be doing for our kids and communities? And I tried to find some university partners to help us answer that question. I don't know if I didn't ask it the right way or not, but nobody really was setting anything up that was answering those questions. And so at that time, I made the decision that I wanted to go to graduate school, and I wanted to learn program evaluation. I wanted to learn how to be able to assess if what we were doing, if what we were spending millions of dollars on was working or not. And so I applied to schools all around the country. In sociology, I was really interested because I saw psychology as being how to help individuals heal. But sociology to me is about how do you help society heal? And that was what I wanted to do. How do we help these broken societal issues? How can we help them get better? So I applied all around the country. And at the very last minute, this was fall of 1998, I heard Dr. Del Elliott, who's the founder of our center, present at a conference at the Office of Juvenile Justice, Delinquency, and Prevention in Washington, D.C. And Dr. Elliott presented about the blueprints programs and the work of the Center for the Study and Prevention of Violence that I now direct. And he was talking about using evidence-based programs, making sure we put into place things that work. And it was like, oh my God, someone is doing this. So I added CU Boulder to my list of schools and got funding, and I came to Colorado. I'll say a couple other things that really influenced my career at that time. Well, Columbine happened in April of 1999. I'm watching all of this on TV. I'd just been to Colorado, to visit the campus, and I had accepted that I was going to be coming here. And, that, like everybody, in the nation, I was just kind of blown away. And that really impacted some of the trajectory of my work, because I started to work at the center, first as a volunteer and then as a graduate research assistant. And I worked on the project Safe Communities, Safe Schools in its very first iteration, which is still going today. And it's a comprehensive approach to work with schools. So that's a little bit of the story. So it's a pretty awesome story of how I got involved, I think. And it's come full circle that I get the great privilege of directing this precious center.
So I'm really curious. What is a political theory degree? What do you study with a political theory degree?
Well, it was a really cool degree. So I studied the Greeks, Plato, that kind of stuff. Then we went on to the Hobbes, Locke, Rousseau, the that set of theorists who
Mm-hmm.
really influenced the Enlightenment. They influenced, so these theorists that influenced the underlying values and setup structure of our country, that was theory. That was a set of ideas
Mm-hmm.
that won out over other ideas. And I'll have to say, some of those ideas were really focused on the individual above the community. So we think, well, why are we so individualistic in this society? Well, some of that comes with the founding roots of the philosophy of the and the values of the founding of this country. And I'm not at all, trying to bash this country. I'm just trying to
Mm-hmm.
take a close look at what's serving and what wasn't serving. And then we went on to study postmodernism, things past the Enlightenment, and um, existentialism, all kinds of things like that. All sorts of traditions of political philosophy.
That's pretty fascinating. I can only imagine, as a person who's literally studied that, it must be at least, I'm going to use a pretty vanilla word, interesting to observe the world and society that we live in now, where yes, it is very individualized, but it feels like there's very little critical thought that ever happens in
Mhm.
a day-to-day
Yeah,
encounter.
that's a great point, Jonathan. And I know I will say this about you, like whether or not you've studied this stuff, you know culture and society in such a deep way, and you're so reflective. So the points you're making are very, very, very wise. And what was interesting, Alexis de Tocqueville wrote a huge book that's like this big, called Democracy in America, and he predicted some of these things in the early 1800s when he visited the United States. He was worried. He was
Mm,
worried about the lack of connection, the lack of like social networks that were happening. He was already
mhm,
seeing the decay of that. He was worried about something. I'm not sure if he coined this term or someone else did, but it was like the lowest common denominator that he saw. Many of these theorists were going lower in terms
mhm.
of creating a mass culture rather than in other societies. It was more about raising people to higher standards and and aiming toward greatness. And so it's like, why don't we flip things? Why don't we
Yeah.
do it different? And I think honestly we can connect that to what we're probably, we can connect it. I mean, we don't have
Hmm.
necessarily data, but some of these broader social forces and how they are likely related to the violence that we see in the United States today. I and I'll tell you, when I was getting my PhD, that is what I wanted to do my dissertation on. I wanted to look at how are these broader social forces, capitalism,
Hmm.
racism, um, these structural forces that are, how are they leading to crime and violence?
Yep.
And oh my God. So I did some study of that, but I couldn't do my dissertation on it because I was doing a quantitative dissertation, which meant I would have needed like cross national data on
Hmm.
those measures. And I would probably still be in school. So trying to study that. However, I think there's still such great value in looking at those, trying to, even if we don't have quantitative studies to show that, we can still begin to look at those forces and try to break down to different studies so that we can better understand those relationships. And as it is many, many years later since I've graduated, some of that, some different types of research like this are out there.
Hmm.
We're seeing some great studies around showing the relationship between racist lending practices in communities and violence. And those kinds of things, the more we can show that relationship and dive deeper to the again, we always talk together about the root causes,
Hmm.
and that's what we need to do, that so we really understand and address what's really going on.
Well, I'm actually glad that you brought that up, because as you were talking, that was one of the first things that I was hearing is identifying root causes to violence. And I want to bring it back to kind of your what I would lovingly call your origin story, right? And the work that you were doing in Houston, and the light bulb that went off of how do we know what we're doing, if what we're doing is working? So there's a two-part question here. I'll ask the first part of, when you ask yourself that, and in understanding that, asking yourself that question, having that, I don't know if epiphany is the right word, but having that, it has led you on a path to where you've been continually working with communities and helping communities evaluate the strategies that they have taken on to address the violence that they are encountering. Um, do I'm being very careful about how I ask this question, because I don't want to seem like I'm a doomsayer, but with the root causes that we know being capitalism and racism and things that are kind of out of the small amount of people who are activated to affect change, do we know if these strategies are working? That was a very long way to ask a very simple question. Do we know if these strategies are working?
Well, Jonathan, let me ask you a question. When you're saying these
Mm-hmm.
strategies, what are you kind of talking about there?
Well, community-led strategies, right? So
Hmm.
these community coalitions that come together, whether it's around youth violence, or it may be coalitions that are coming together for suicide prevention, or it
Hmm.
may be coalitions coming together
Okay.
um, for all the types of prevention and intervention that we talk about.
Yeah.
There's these small pockets of people who get activated and are really committed to the work, and they want to make a difference in their communities against this massive thing of a system, right?
Yes.
The isms that exist. How
Yeah.
do we know that work, or that methodology works?
That is a great question. We can test if if the work of a coalition and the interventions that they're doing, if they work or not. And we can do that. I mean, there's scientific ways to test that. In fact, we're just finishing up our data analysis of the two communities that we've worked with in Denver, and we'll call them communities A and B because we're not identifying the names necessarily of the
Mm-hmm.
communities we work with in the research. And what we've done, and some of the answer I'm going to give to this is a bit researchy. I'll just give
Oh,
that limit.
feel free,
And
feel
then
free.
so I'm going to go there, and then we can also talk about it from some other lenses. But the way we studied it in this last project, and it's a really reasonable, rigorous way to study community change that's not super expensive. And so you can use these, we call interrupted time series designs, or another version of it is difference in difference. And these designs actually they look at the youth violence. In our study, we're looking at arrest rates over like a 10-year period. So before the intervention, during the intervention, after the intervention. And then you can create these, basically they're called synthetic control communities. So a study is much stronger if you have comparison groups or a control community. And so what the synthetic control community basically, it uses the data, and it creates the best match communities it can to the intervention communities,
Mm-hmm.
and then tracks all that over time. And you need to be working with great statisticians for this, but you can tell what's happening in specific neighborhoods by doing those kinds of studies. That's at the neighborhood level. Now, what that's going to tell you is what's happening in that neighborhood in terms of, in our situation, it's youth arrests over time, youth arrests for violence over time. But it's not telling us what were the impacts of individual interventions that were happening in those communities. So it's not specifically saying it was the coalition or it was, A, B, C, D, E, F, G. Like, we just know that it was, for example, we saw significant decreases in youth arrests in community B over time, which is amazing. But we can't absolutely say, what was causing that. We can say this compilation of all the things that were going on. There was a very active, powerful community board. There was a boatload of many different interventions that they had created. For example, they were doing social emotional learning throughout the whole community. There's all kinds of youth athletic programs. There's lots of community organizing going on. So the combination of everything did reduce youth arrests in that community over time, and that difference is significant. And that was even when it was compared to the synthetic control. So that's a powerful demonstration of impact. Now, many times you want to say, well, we want to understand what happened there. We want to see what was the coalition, what did the coalition do? And did that have an impact? We want to understand maybe the neighborhood social processes that might have changed over time. We want to see the impacts of each of those individual programs. And so that's why I asked you kind of a little bit more detail of the way you were asking that question, because we can do evaluation on each of those components as well and see, did this program that is a mentoring program let's say after school that serves 40 young people, did that have an impact on those young people's risk and protective factors and youth violence? And so that's what kind of a little bit about ways you can design and test.
That's really helpful. And of course, I'm playing a bit more naive about the situation than I actually am. For the sake of, I want people to understand that when they're out here doing the work, or they want to be a part of the solution, there is a way to measure your impact in ways that are documentable. And when things are documented, they also are fundable. So I want people to hear that it's not hopeless. Let's continue on that, because for full transparency for the audience, I was a part of one of those community coalitions that Beverly just mentioned. And when I first heard of it, I was pretty much in the dark as to what this process looked like. And I'll briefly walk you through the process. A community leader had came to me and asked me if I wanted to be a part of this community board focused on youth violence prevention. And I said, maybe, let me learn more about it. And there was a process of pulling people together to be a part of this board. And then I heard that CU Boulder and the Center for the Study and Prevention of Violence was a partner in forming this board through a model what's called Communities That Cares. Do you remember what year the CDC started CTC?
Well, I don't think the CDC started. I can tell you, Communities That Care started around 1995 or 6, probably, because we were using it in the Gulfton community. We were one of the first way back then. And the thing about Communities That Care is there is evidence that there's a randomized trial on Communities That Care that was done in primarily rural communities. And the results of that trial have shown significant impacts on violence, on substance misuse, on all kinds of different outcomes. And so it does have that strategic planning framework does have an evidence base behind it. However, I want to add this: it hasn't been used very much or tested in urban settings and in communities of color. That hasn't been tested as much. There's starting to be a few more studies that way, but not the original trial wasn't.
Okay. So am I right to feel honored to be a part of one of the few urban studies?
Yeah, you are. And you're part of Community B.
Right. Yeah.
which was the community that had the significant changes.
So I heard you when you mentioned being in Texas and and asking yourself that question, how do we know what we're doing works? And having a
Mhm.
bit of difficulty finding a university partner who was willing to
Mhm.
do the research. Um, Obviously, we were successful here in Colorado.
Mhm.
What did that relationship look like? And I'm asking from your perspective. I could talk
Mhm.
about it from my perspective on the community
Yeah.
level.
Well, I kind of want to go back in time to 2011 when Dell reached out to the communities. He reached out to Reggie Herder
Yes.
about talking about what neighborhoods in Denver might be appropriate for this partnership. So the funding
Hmm.
source is the Centers for Disease Control and Prevention, and we're a youth violence prevention center of excellence funded by the Centers for Disease Control and Prevention, and we're one of five across the nation. And what happened was Dell, when he was writing the grant, he took great care in talking to city partners about what communities would make sense for this, and
Hmm.
then also making sure that the communities had what I would call the seeds of a prevention infrastructure. So there were people already in the community, like how you said, that were activated. There may not have been a ton of them back in 2011, but when the grant was being written, maybe not so many, but when the grant was received, I mean, hundreds of people came out and came to our kickoff meeting. I don't know if you were there at that time. It was way back. That was 2012. So when we had that for 2011.
No, I don't think I was there.
Okay.
I was probably in the peripheral at that point.
Okay. So you're coming on the scene pretty soon after. And okay, so then I want to say this part of the story. Right at the start, we were called out, and community members said, university, we don't want this to just be some hit and run research where you come in, get your data, and you leave. That's what we've had happen here. There was a lot of distrust, even though there was work on the front end to build those partnerships and connections. And it was great that that stuff was coming out, because the worst is if people aren't talking about it and they're just not coming to stuff, like they're just with not there. So then we could start. I mean, this has been from the university side of it, is that this is every interaction is about trust building and staying the long course. So there's really listening to those very valid concerns. And they're also very valid because, like, our center, we're all grant funded. So we were saying we're in here for the long haul, but the truth is we don't know if we're going to be funded to even have jobs for the long haul. So that was all we could say, is we're going to do everything we can to stay committed to these communities, as long as the communities also want us there. So we were very careful about that as well. So we had this first project, and I can tell you some of the more details about working with them. But when we finished that first one, and then we started in the second one working with two communities. The first one, we worked with community A and B. Community A was the treatment community, and community B was the comparison. The second one, both community and A and B were intervention communities. So when the grant ended for the first grant, we made the commitment to the community that if they wanted us to apply for the second one, we would apply for the second one. If they did not want us to, we would not do it. So it has to be a partnership. And then I'll go on just to say, then we have been very fortunate. Thanks a lot to the work we've done with both coalitions and the communities, and with all the community partners, because the third one that we are in right now, which is funded from 2021 to 2026, it's working with both of those regions basically in the
Hmm.
city, and everything that's in the project was all determined to be in there by the community. Nothing was, oh, we think we'll do, what about, this? It was all, what do you we brought ideas forward. You remember, Jonathan, we had like 30 different ideas,
Yep.
but then we said, you prioritize community and you let us know. And we only submitted that grant, knowing we were working in partnership. And that is the only way that is the only, I think, I know you don't really like the justice word, but to me, it is like the only just way to work with communities is in partnership. And then I'll say one more thing, but that, what we also emphasize too is that, okay, we have the science, the formal science, we understand the ways theories have been designed, but the community has the lived experience. It's not a but, it's an
Hmm.
and extra, and elevate that the community has the lived experience and the knowledge of how things really work in that community, what they really need, how, all of it. And I'll tell you, one of the things that, I don't know if we've talked about this before, but this whole thing with the broader structural forces that have caused
Hmm.
the disparities in the communities that have led to why there is increased violence in these communities. Some things in the research have been disconnected from that. And, for example, the risk and protective factors aren't always talked about within the lens of how does racism and structural racism impact those risk and protective factors. And that is changing now in terms, like, the research is hopefully catching up. People aren't letting it stay this way, but the communities have really done, I think, the best job of naming these issues and not letting researchers come in and not, present part of the truth, but not the whole thing. And that's just, again, that's why we have to work so close together.
Yeah. Again, I was a part of the process, especially with that third grant, and I was so appreciative to have the opportunity to be at the table, and I mean that from multiple perspectives. Career wise, I was really grateful to have made it to a point in my career where I was able to be in those conversations, but also recognizing that what we were doing in partnership, when I say we, there were a whole lot of people. There were
Yeah.
football coaches of little league programs. There were people who were doing direct services with young people around media. There were just so many non-traditional players at the table for months, really coming together in a very intentional way, deliberating on what that grant application to the CDC for several $1 million should address. And I'll even say it this way: as a black man who is a formerly incarcerated person, former gang member, the fact that I was at the table in even in that capacity and could speak from that lived experience to help inform what we were hoping to attain funding to research to problem solve it was a life changing experience. It has empowered me to be able to speak for my community in other spaces that um, there isn't representation, and to not only suggest but demand that we have representation from the communities that a government is supposed to serve.
Yes.
So that was just an incredible experience. And when you're in the moment, you don't necessarily recognize it. And then you step back, especially after you get the email saying you've been awarded the grant. It's like, oh, that worked.
I
That
know.
was amazing. Yeah.
Um, I want to go back to your question
Yeah.
still. There's a little bit, I mean, there's probably, we could talk for hours about this topic, but I do want to say that another piece of the puzzle that what we try to do with working with communities, and again, this is a long time of me. I've just been doing this work since the 90s, and I want to say this: every community is different, the
Hmm.
partnerships are different, and at the same time, there's things that we've learned in terms of overall approaches, And I'm still learning. So everything I'm saying with that. And then what we try to do when we're working with community and school partners, we also try to bring forth the strategies that we know from research, evidence-based programs, practices, policies that have demonstrated impacts in other places.
Mm-hmm.
And a lot of times we'll bring those ideas, those programs forward to the communities that we're working with, and we try to match those programs to what the communities identified as their top risk and protective factors. For example, in Community B, they identified concerns around early and persistent problem behavior. So that's like young people maybe bringing a weapon to school or getting into fights or using drugs in elementary school. And so that was one of the reasons they brought in social emotional learning in the schools and community wide. So that would be an example. So what we want to do is we want to ideally promote these, programs that already are proven to work. And also they have to fit the local context. So you want to use the best available evidence, but also looking very carefully at fit and looking at capacity. Is this community motivated to do this? Do they have the infrastructure to do that? I've been a part of many projects that the community had motivation, but there wasn't an infrastructure there to actually allow the program to take roots. Like the leadership couldn't come to the meetings
Mm-hmm.
to get trained in the program. They just didn't have the capacity to carry it out. So it's like this art to matching the science to the community. The other thing with that is that many of the evidence-based programs have not necessarily been developed in communities of color. And
Mm-hmm.
we'll say, oh, well, we should use an evidence-based program, but there's not always evidence-based programs that fit the context of the community. And I think we saw that together when we were developing the strategies for what we just did and the latest project. And also we saw when we were trying to bring evidence-based programs into the communities said, wait a minute, we've got programs that are trusted in our community, that some of them been here 50 years. Why aren't we giving funding to those programs? And so that's what we are doing. And we're trying to build the evidence base of the community rooted programs that have, been tried, tested, or used in a long time, that there's a lot of trust in those programs, and we want to get them the data that they work, and that so that they'll have that evidence of
Right.
impact.
So that they can be able to navigate the academic, I guess, minimum requirements to become
Yeah.
an evidence-based program, and then be scalable across other communities that are more representative of communities that look like them. Yeah. Uh,
Yes.
what's been going through my head a lot as you've described the process with both community A, B, and now project 3 is a phrase that I heard, I don't know, just a few years ago. And I don't know who came up with it first, but it's come more from a model to a philosophy of it can't be about us without us.
Yeah.
And that's how I have attempted to operate in these spaces, particularly with my time in leadership with the Office of Youth Violence Prevention, making sure that we had youth representatives helping inform and advising the quote unquote grown ups. So, Beverly, I want to ask one more question. Where do you see the future of this type of work? And when I say this type of work, I
Yeah.
mean partnerships with universities and with communities. Do you see this model that's being used here in Colorado being duplicated and replicated across the country?
I love this model. I love the partnership between the kind of official science and the lived experience. And there's no way that the researchers in a university are going to be effective researchers without, if you're trying to, research in these areas, and when we're talking about community and society, without that partnership, it's like either one is missing something.
Mm-hmm.
And I say that because We still deal with some of the distrust around the science and the methods. And I think that the communities are going to, my hope is that they're really going to see huge benefit by having this data-driven approach. So that when they're able to show that they've gotten results and they can get the funding that they need and deserve for their programs. And I think that all that is kind of necessary for these things to grow. There is a real problem around funding of violence prevention. And it's getting, scraps, and it's so under-resourced. And this kind of work is not cheap, and it shouldn't be. I mean, it needs to get the resources. Everybody does. The community partners, the university partners, like everybody needs to have what they need to do the work well. And I'm not trying to say, oh, the university should get more. I mean, there's a lot of cost in doing business with the university, the indirect costs, and I understand. I know that it can be really frustrating because you get these big giant grants, and probably 40% of it is going off the top to the university, outside of any of the work on the project. And I have to just be honest that is the cost of doing business with universities, the way they're structured right now. And I do think there's a lot of benefit, though, to having that community university partnership. So I hope maybe that there's all kinds of different funders that could come alongside to support this work. Because, for example, let's say if there's funding that goes directly to the nonprofits in the community, then that can bolster them. If funding comes to our center that's not through grants, like a donor or something like that, then the indirect cost rates don't get tacked onto that. So I hope we can look at how resources can be pooled. And again, the main thing, it's got to be really that the infrastructure of the community needs to be there to do this work. At the same time, the infrastructure of the university partner that's supporting also needs to be there. So sorry, I'm getting into a bit of a funding discussion, but.
Well, no. I think that's honestly, one of the most important parts of this conversation for who I think my audience is, because these are the things that matter, right? In order to do the work, you need the funding. And I have my fingers crossed that with the creation of this new national office of gun violence prevention, that we as a country are being serious about providing sustainable funding for the spectrum of the work that's happening, both at the research level, both at the evaluation research level, at the community level.
Yeah.
And a man who I've worked with for the last couple of years now and come to respect and understanding when we talk about root causes of violence, if you move far enough upstream, you're really starting to talk about social determinants of health and health equity, which in my mind is what government should be investing in, and that everyone has equitable opportunities for great social determinants of health.
Yep.
Because when those things are underfunded, when communities and neighborhoods aren't invested in to maintain a proper to invest in social determinants and health in these communities, violence is a product of that. So,
totally. Yep. And the costs of violence are so high. I mean, the financial costs, it's like $229 billion. And that's probably low. And then you think about what the cost of prison is, and the loss of potential, loss of what we could have in our society from the wonderful humanity that we have. And instead it's like all backwards. And so if we even probably used a quarter of that money and just said, we're going to just try it, and we're going to use a quarter of that 229 billion and put it into prevention. And yeah, it may take 10 years, but what will we have as a result of that investment?
Yes. And again, this is why I love talking to you, because
We're
we
on this
are so in alignment.
team.
I said that was going to be my last question before we move to the other segment, but you mentioned something that I think needs to be highlighted. Recognizing the burden of cost, and that the university gets this indirect costs in these grants. I know that one of the strategies that CSPV is overseeing is um, helping young people enter into the field of violence prevention. Can you talk about that for a couple
Yeah.
minutes?
Yeah. So in this, in the project that we're working on now, we really are trying to engage young people in understanding all what they can do to be involved in violence prevention. So there's all kinds of different careers and pathways that they can enter in. So what we're doing is we have something we call it Youth-niversity, and we're training young people in all the different core areas of what we think will give them sort of a base understanding about violence prevention. And then we're providing opportunities for them to get involved. For example, they can support some of the different strategies that we're doing to implement. So some young people are supporting the community nonprofits, and they're helping to support building the capacity of some of these community nonprofits. Others are peer navigators, where we're going to be matching youth that are maybe struggling with things that could result in violence or mental health challenges to resources, and assigning them to peer navigators that can follow them through. And we've got young people who, better than young people, who are in a good place to be those navigators. And then they're working with the nonprofit groups. Certainly sometimes they'll need a certified mental health, but they'll help to foster those connections. And then we've got, let's see, we also have young people. Oh my gosh, our young people, they're so awesome. The overarching umbrella of it is the game changers, but within the game changers is the power of one. It's the No Justice, No Peace podcast. We've got a youth advisory council. We've got these youth interns. We've got all kinds of different opportunities and pathways so that young people can explore ways that they can get involved. Some, like I said, they might be interested in being more at the individual level and becoming therapists, or maybe they're going to want to be probation officers. Who knows? Maybe they want to be in the justice system, involved in that way. Others may want to go on and be researchers and, go on in that long-term path and get their PhD. We want to show lots of different options. And then, what we're also really talking about with our young people is the idea of spark, and what are their unique passions and interests, and making sure that we understand what those are and how the community can see them and support them on their unique journey.
I love that. And I'm just
Me too.
a personal moment. It makes me miss even more just working with young people and being at that level. I'm so disconnected from my young people, and I miss it. And thank you for supporting that. Like, that makes my heart smile.
Mine too.
Um
Mine too. It's just
yeah.
like, for sure, heart smile. It's good.
Hey, so this has been a great conversation. I knew it would be, and I just thank you. I want people to know a little bit more about Beverly Dr. Kingston. Um, and so I have this segment of the show that I call What's the Word? And what we do in this segment is dive deep into, was as deep as you'll allow, into the minds of our guests. And so what I do is I start a phrase related to who you are or maybe your expertise, and then you finish it with the first word or phrase that comes to mind. Okay.
Okay.
All right. So the first question is: success is,
Following your heart,
community is,
the kingdom of God,
the solution to gun violence is,
a comprehensive public health approach
I love it.
that addresses the root causes. No question about that.
The one thing that I want people to know about me is
What's coming to my mind at first is that I care so deeply about these topics.
my favorite food is.
Sushi.
My favorite book is.
Oh, that one, my favorite book. Well, I really love I love the work of John O'Donohue, and he's passed on, but he's an Irish philosopher poet. I love his books and work. I love. There's a book that was from the '90s called A Different Drum, and it's all about building community. And that was a real life-changing book for me in terms of actually thinking about community as the kingdom of heaven. That really opened my eyes to that.
And I know you're finishing a book right now, right? You want to talk about that for a minute?
Yeah, I'm finishing a memoir. It's called Soulshine, a memoir of courage, healing, and hope. And it is, whoa, it's very personal, and it's very, very personal. So it's like I'm still getting used to talking about the book
Mm-hmm.
because it's like I first had to write it for me, and I've been working on writing it for almost 7 years, and now it's almost ready to go out the door to try to find a publisher or an agent, or both. It's a story of my healing journey and in listening to the call of my soul to overcome some real self-destructive patterns with addiction, dysfunctional relationships. And it's really about my learning to live in my truth. And soul shine for me, not just for me, but also the reason I'm putting it out into the world is I'm hoping that it can help others maybe who are struggling with addiction or some of those kinds of things see that there's a way out, and and follow their own pathway to soul shine.
I'm looking forward to reading it. Of course, we'll talk, and you'll keep me abreast of when it's ready. And if everything goes well with this show, I will make sure to promote it with you. Yeah. Okay, a couple more here. Your favorite form of self-care?
Okay. There are two funny ones. One is running and the other, or working out, but I mean, especially running is what I love. And the other is taking naps. I absolutely love taking a long nap, not a short nap.
Okay. I'm not good at either. I think that people who run for without being chased, I think they're crazy. And I'm not good at taking naps unless I'm just dead tired. So, anyway, favorite television show?
Oh my God. These are such hard questions. Okay, I can name a few. So one show I love is the Gilmore Girls, and I'll say Gilmore Girls because I was a single mom for many years, and I watched that with my daughter, and it was really special for us.
My daughter also loves that. Favorite movie?
Okay, I have to go with Shawshank Redemption.
I wasn't doing the work that I do now. My career would be.
Can I have a couple?
Maybe.
Well, one, I think I would want to be a potter. I really would. I would just want to do pottery. And I don't know that I could make any money from it, but I really enjoy that. And a second, I think I maybe want to be in the medical fields, maybe like a doctor. Yeah.
Okay. My why is.
My why is to create the conditions that will make our souls shine.
I am.
I have two. I am tired, and I also, because I've been at this a long time, and I am very hopeful.
Awesome. All right, the last one is my theme song is.
Hmm. My my theme song is um, well, something maybe by Cat Stevens. I'm gonna go with Peace Train.
Okay. All right, that's
Go
a
with
good one.
Peace Train.
All right. Well, Beverly, you've been such a fantastic guest. I just really enjoyed this conversation. So thank you. The show is called The Credible Messenger.
Yeah.
And as I see you as one of the people who personify that title in your career path. When I think of researchers and the, I guess what I would say, the typical relationship that academia has with community. Matter of fact, last year I attended the National Research Conference on gun
Yeah.
violence prevention, and the first day was just so full of all these presentations of work happening across the country. And as we know, across the country, that young Black men are disproportionately
Yeah.
victims of gun violence. And because I guess there was just availability of funding now, so many of the research presentations were about young Black men dying in disproportionate rates. And by the end of the first day, I felt emotionally and spiritually just drained
Yeah.
because it was like research porn.
Yeah.
Look what
Yeah.
I could tell
Yeah.
you. Look what I could tell you.
That makes me
And
cry, or actually, I'm tearing up. Yeah.
yeah, um, but that's never been my experience with
Mm,
CSPV and with you and with your team. It's
yeah.
always been about making sure, again, like we've said it multiple times in this conversation, that this was a effort to empower communities that were being researched to participate and lead in many cases the research and not be
Yeah.
exploited.
Yeah.
And so I appreciate that. And that's why I say I see you as the leader of CSPV as a credible messenger for what
Mm,
that means in the realm of research of violence prevention.
mm.
And so with that, I want to give you the opportunity to leave a message with my audience and our listeners.
Well, Jonathan, I do want to thank you, first of all, so much for those words. I think for you to describe what a credible messenger is and then to put me in that category is a huge honor. And that really means a lot to me. So I thank you for that. And early on in the podcast, you said, Jonathan, that some people get activated in the community, and activated to address violence. And they, we know they come and they're at every meeting and they find a way to, gosh, be involved. And we need everyone to be activated. The problem of gun violence and violence, because violence is a risk factor for gun violence, so they
Mhm.
go hand in hand, is is a problem that affects all of us. And every day that goes by, more, unfortunately, more and more people seem to be being affected. And I don't think people realize the breadth and depth of the solutions and how there is a place for everyone in the solutions, and that it's way about, as we've said, I mean, we haven't gone into some of the nitty-gritty details. Maybe we can do that in another show of, what is the breakdown, what is a public health approach to violence, and all the different dimensions of that. But within it, there's like everybody can play a part. And even if it is as simple as what we would call being an upstander, where if people see something that they're concerned about in their community, that they try to get that person the help that they need. And sometimes it may be you anonymously report that concern, but other times it's like you find the agency in that community, or someone that can help that young person and get that person help. So I guess my message is we need everyone at this table, and there's a part for everyone, and it doesn't have to be so big or outside your scope. There's a place for everyone. And if we recognize that, we really can make a dent in this problem. And the last part of this, I often end with saying that I do have so much hope. I know we can plant the seeds today. You know, what we're doing with all the young people that are part of Youth-niversity and the Game Changers, we're planting the seeds today. We might not see all the fruits of them tomorrow, but we will, we will in time if we keep planting those seeds. So I just say, let's all keep planting those seeds, and we can really reduce violence.
So, Beverly, this has been fantastic. I thoroughly enjoyed this conversation. I am certain that people who listen to this conversation they'll find hope in it. Again, that's really the intention of this show,
Yeah.
is to give people hope, to say that there are
Yes.
ways that everyone can play a role, no matter what they are. And you summed that up just perfectly. I want to give you opportunity, if people want to contact you, how can they do so? If they want to support the work or projects you got going, how do they get in touch with you?
So they could go to our website at the Center for the Study and Prevention of Violence. And our website is cspv.colorado.edu. And, you can look at all the different projects that we have going. And because we really talked mostly here about community violence, but there's things that we do with schools, communities, all kinds of different projects that you could take a look at. Of course, if you want to support our center, there's ways that you can do that as well that are on the website. And certainly if this brought up some topics that people are interested in learning more about from me, they can also email me, and my contact information is all on our website.
That's great. I encourage people to go to the website to learn more. There will be a follow-up episode, because I do want to talk with Dr. Kingston specifically about what we can do for our schools, because I know there's a lot of people who are interested when it comes to violence in schools, and learn what's happening. In the meantime, thank you all. If you've made it to this point of the episode, that means that I have done my job in bringing you something that was of value. So do me a favor and please share the word and download this episode. Other people know about it. Share it across your networks. And I always forget to ask you to do this. Rate the episode so that more people know about it and can get plugged in. In the meantime, I am your host, Jonathan McMillan, the Credible Messenger podcast, and I will be back with you with another episode soon. Thank you. Good.